Have you ever questioned if osteoporosis is caused by natural bone mineral loss? Then what is the benefit to taking osteoporosis drugs? Think about it. Why are your bones losing mineral in the first place? Watch this video, and we at Medical Mysteries Investigated will delve into the disease of osteoporosis and at the end provide you with the steps you can take to resolve this disease. Please note that we are not doctors and we are not providing medical advice. We are simply following the science and providing you with the information that your doctor most likely doesn't want you to know. What is osteoporosis? The root osteo means bone, and porosis obviously means porous. The porous bone means the density and quality of the bone is reduced, thus leaving the bone thin, brittle, weak, and easily broken or fractured. To better understand the bone density decline, we must first remember the bone is living tissue that is constantly being remodeled with new bone cells replacing the older cells. Remember your high school biology? The old cells are resorbed into the bone matrix. When we are young, full of energy, and are physically active, our bodies produce and deposit bone cells at a faster rate than what is resorbed. However, as we age, our energy level typically decreases, our physical activity decreases, and our bone cells resorb faster than the new cells are deposited. In osteoporosis patients, resorption happens at a higher rate than normal. Who's at risk then? As you might guess from previous explanations, the people at risk have certain conditions. People over 50 years, female gender, previous fractures, rheumatoid arthritis, low body mass index, poor nutrition, eating disorder, excessive alcohol consumption, smoking, and a sedentary lifestyle. Are your bones aching yet? We hope not, and assure you that relief is just a few minutes away. We are going to a deeper fact-finding investigation that isn't shown on the websites we visited for osteoporosis. Before we do, please give us a like on this video and subscribe to our channel. The science. Since 1892, the medical community has followed the science of bone remodeling known as Wolff's Law. It isn't known as Wolff's theory or Wolff's hypothesis or even Wolff's suggestion. It is a proven law of bone science that states bone will adapt to the loads placed upon it. Increased load leads to increased bone internally and then increases the cortical wall thickness externally. Converse to that, the lack of bone use or stress leads to a decline in bone strength and bone thickness. Or more simply, bone remodels and restructures when stressed and weakens when not stressed. How does this relate to osteoporosis? Wolff's Law clearly states that if bone is not stressed, then osteoporosis will occur. According to Wolff's Law, to combat osteoporosis, the bone needs to be stressed. According to science, in this case physics, stress is the force or load acting on a unit of a material. In our case, the material is bone. Reviewing the Who's at Risk list, it is easy to conclude that candidates are less active than young people. People over 50 years put less stress on their body than, say, a 20-year-old. People with a lower body mass index will put less stress on their bones than people of a higher mass index. All other factors being similar, of course. Also, female gender candidates are typically smaller built and have less bone density than male gender candidates. For the human body, the force could simply be the body weight when standing. Obviously, more force would be applied if that body were moving. So, according to the science, in particular Wolff's law, the remedy for osteoporosis is increased bone loading. This can simply be accomplished by increasing your daily activity by walking, biking, hiking, or other forms of movement. Or force could be applied by carrying bags of groceries, hoeing a garden, or simply lifting cans of soup and putting them in your cupboard. As a side note, little pills are not heavy enough to make a difference in increasing stress on your body. If you are unsure how to start a safe exercise program, ask an expert at a local fitness center or talk to a physical therapist. Thank you for watching this video and enjoy your new activities.